Welcome to another episode of You're Not Depressed, Just Unfinished. What if we'll take a look at life in different ways? That there are people who bring a lot of composure. They look normal, they have it all together. What if there's different stories to them? What if those individuals actually have burdens, their stories they want to share with somebody? They don't know who to go to. They don't know how to make sense of their struggles, but all they've been told is just plow through, push on, and you'll be just fine. Are they fine? We will learn that today. My expert today is an individual who, for 30 years, sat across the table as a clinician from individuals who had everything figured out on the paper. They look normal, they look great, they smell great, but they had the stories to share. And they wanted somebody to hear those stories and help them find a way through. That doctor is Peter Zafirides, and he's a psychiatrist. Today, we're going to turn the table around. That learn from him what has he heard and what insights after 30 years he can bring to us so we can live lighter with more hope and live better. Peter, welcome. And let me read about your background. You're clinical assistant professor at Ohio State College of Medicine, co-founder of the Central Ohio Behavioral Medicine at Columbus. For over 30 years, you've been treating depression, anxiety, and trauma. And you've been recognized as the best doctor in America for 7 years in a row. An award that actually is very powerful. I want to learn more about this. A compassionate doctor. That is very awesome. I don't hear that very often. So, Peter, welcome. Did I miss anything about your background?
No, not at all. That was wonderful. That was nice to hear. I appreciate it.
You're
But yes,
welcome.
I guess the only thing I'd add is I'm a father of three children and married for the last 18 years.
That's the best accomplishment. Those
Yes.
are the best accomplishments. They say, Ardeshir, who are you? I said, yeah, I can talk about my degrees, all of that. I'm a father, I'm a spouse, I'm a brother and a family member. Those are the best quality of life.
No, thank
Uh,
you for having me. It's a privilege to be here, Ardeshir.
you bet. Just a note for our listeners that just so Peter and I was so excited to speak with Peter, and you will understand very soon why. We started a podcast and I forgot to hit the record. So we went through the whole podcast, getting to the closing. And I said, oh my goodness. So Peter is gracious enough to give me another hour of his time as his wisdom. So thank you. And a life lesson, always put the right button before
Oh gosh, that
before
was
you give a
wonderful.
session.
Yes.
You got it. So let me start. So Peter is very active in social media, especially LinkedIn. He writes a weekly post on LinkedIn and about his observations, clinical experiences, and some of the research he's been doing. In a research post you wrote, many people are so accustomed to living in a way that is seen as normal, but in fact, they're dealing with anxiety and depression. And when you ask them what is going on, they don't know there's a high cost behind just looking normal. And because they have a race in mind that is continuously comes up at night, inability to relax, and the constant pressure of believing that everything depends on them. They need to go. And if you ask them, what's going on? The answer typically is, this is who I am. I'm always being like this. Peter, is that true? Are they always like this?
That's a complicated question. And I think people's experience may be that they always feel like that, but there's also the other feeling that there's something wrong, right? So I feel like this, but I'm also worried about this not feeling right. I'm anxious. I'm nervous. I feel hopeless. It feels mundane. Things are going every day the same, and I don't know how happy I really am. And we all figure out ways to deal or rationalize with that. But it is kind of that dissonance, if you will, that disconnect between what I am doing, but yet in my mind, I recognize that this is pain, this is suffering as well. So, how do I come to terms with this?
Yeah. So those individuals that they push through, they say, I'm normal, I'm just a regular guy, a regular lady, but they feel anxious, they feel a disconnect. There's an element of suffering, low level suffering continues. At what point that becomes a risk factor that those individuals could benefit from help from professionals like you?
I'll give you a visual example, right? We can hold maybe something fairly light in our hands and hold it for a long period of time. And we acknowledge that is light. But if we never let it go and continue to hold it, at some point it is going to become weighty. And at some point we can't support it and we have to let it go down, right?
Yeah.
But the initial part of that may not have been so much of a problem. And I think that this is how we see the way that we, all of us, this is not exclusive of psychiatrists suffer from this too, and I do and have. So it's part of this feeling that, okay, I can handle this. This isn't much. This is how I'm supposed to do it. But things begin to break down. And I think
Yeah.
that's the tipping point. And breaking down can be various things. It can be breaking down in terms of relationships, where suddenly there is conflict or there is difficulty within relationships. It could certainly be in the workplace, which I'm sure you, with your years of experience, can relate to in terms of how this can break down and affect the
Yeah.
workplace. Or it is a breakdown of health, whether it is hypertension or cardiovascular disease or any kind of problem that takes the stress from something that was tolerable to this point where I have to now let it go, because if I don't, I'm going to lose a relationship, my health, or my
Yeah.
livelihood.
That's right. So you're talking about that you can continue being normal. In fact, there's a term I use, that death by resiliency. In our society, we've been told and rewarded, push through, the don't give up, don't quit, like a go, go. But what you're saying, that pay attention to quality of your health, pay attention of your quality of your relationships, about how much you're handling, and are there costs to looking normal and go and plowing through? And then, so when people come to you, why do they come to you? At what point, when is it that people say, I need to see a clinician?
Yes. I think it's varied in terms of, and I'll speak to my experience as a psychiatrist, when people will come to me, but obviously when people are suffering. But I think the two main ways would be either at the suggestion or request of a trusted family doctor or primary
Mhm.
care physician who has said, look, I'm really worried about how you're feeling. They may or may not have treated them, perhaps with various treatments, maybe a trial of a medication or two. And then they say, I think you might need to see someone like Peter to understand this more fully. Or
Yes.
another way is that individuals may enter into therapy, and within the course of the therapy, it's determined that an additional benefit could be made by seeing a psychiatrist. Perhaps we look at a medical or a pharmacological intervention to help ease the suffering.
Got it. So part of that, you mentioned therapy and medication as a complement to the to therapy outcome. How is medication helpful? What does medication bring to healing?
Yes. Succinctly, I don't know. So,
Thank you for your
what do I mean by that? We know that these medications affect I can be really technical and just say what these medications do is they affect the mood neurochemicals in our brain
Yes.
or perhaps throughout our body, maybe not
Yeah.
necessarily just the brain. And the thinking there is with emotional issues, what we see is a change in the neurochemistry of the brain that predisposes you a bit more to depression or to
Mhm.
anxiety. So as we replenish these chemicals, we feel better.
Yeah.
Now, the question is, and you have seen it as well, why do some people respond very
Yeah.
well with maybe minimal amounts of medication, while others can go through trial after trial and they're not getting better? So we know that it's not uniform just yet. And we have
Yeah.
these avenues. And I'm not trying to just minimize them or say that they're not effective. Not at all. We have data that proves that it is effective. But healing is different than
Yes.
just response. That
Mhm.
is where I think is the important part, that we can prescribe medication, but if it is not in a supportive and a healing environment where a person is truly heard, that they really feel that they are being seen as a human being, I don't know that the medications in and of themselves are enough to overcome the suffering and the loneliness that a person feels that may predispose them to that depression. So I really do think that it is a complex interplay of biology, of psychology, and also of
Connection. This is very key. The in my work that people who come to me. So I'm not a medical doctor. I'm a psychologist. So people who come to me, the quality that I see in majority of them is the inability to feel. It's a very subtle difference. People, these are professionals. They can very elegantly describe their thoughts, their emotions. I'm angry, I'm happy, I'm heartbroken. But when you look at their affects, they are talking about feeling versus feeling the feeling. There are no tears. And it's very flat, monotone way they talk about feeling. So that teaches me that in terms of left and right brain hemisphere, because part of the depression early on, we try to numb feeling as a way to survive. We think about things, we analyze, organize. And my understanding is that medication helps to connect left and right brain hemisphere to allow for more fuller experiences. And to your point, still science is being developed. And as medication works with some people, it doesn't work with other ones. Something you mentioned in one of your writings that people come to therapy. Sometimes it's not about something's wrong with me. It's about they're just exhausted of living the way they are. They just want hope. They want a way out, the way through. Share about that. What's going on when you see people coming like that?
sure, yeah, and we see individuals and what is the issue, and on a surface level there is depression and anxiety, but I think that's, you bring up a really good point of a person really being detached even from themselves. And
Mhm.
we can understand it if we look at just an adaptive mechanism, right? If you've got too much noise coming at you,
Yeah.
one of the responses there is to numb that noise so that it doesn't keep affecting you. And I would argue that the individual decides on a conscious level and an unconscious level, it is safer to feel numb than it is
Yeah.
to feel pain. Or
Yeah.
oftentimes it is the fear of what would happen if they are allowed to feel, right? Because a lot of times what we will see is when we are able, and this is my responsibility to provide that safe environment to make sure that the individual knows that they are being heard, they're not being
Yeah.
judged, but it is
Yeah.
okay to talk. When they are able to be vulnerable and find out that they don't just vaporize into nothingness, that
Yeah.
there is
Yeah.
actually something healing that can come by letting their guard down, that numbness has started to be replaced by hope. And that
Yeah.
hope can be very powerful. So, of course, we will marry that with medication treatment when it is appropriate. But I think that a lot of times it is not just the numbness, but it is the fear of what may happen if someone releases some of that emotion. That, again, society has taught us you're just going to be an individual and go at it. They've also, it's only recently that the emotions and psychiatry and psychology have been more in the mainstream media, that it's been okay to talk. Oftentimes it had been veiled in silence, worry about being judged. We've gone a long time in society where we've not allowed individuals to release those emotions or to know that it is okay, that it is acceptable.
That's right. The For listeners who are hearing this conversation, Peter, what are one, two, or three things you want them to think about to know how are they doing? Am I being normal but not feeling normal? Or would I benefit from going seeing a clinician like you? What would you tell them?
Yeah. I think one of the most powerful questions you can ask is a very simple one. Are you happy? And just allow the individual to sit. It's amazing oftentimes how you will see an individual be stopped cold, not know how to respond, or become emotional right at that moment. So I think checking in, yes, we can handle a lot of things, and that represents our strength. And that represents incredible strength from those that might have gone through traumatic childhoods or trauma that we can't even imagine. And the strength to be able to hold on to that, and the power of maybe numbing everything as a protective mechanism, but to be able to sit and just say, are you happy? The other part, how are things in your life? Are relationships okay? Is work okay? Is your health okay? And if the answer to that continues to be no, or yeah, but, then maybe it's time to think about the impact of those emotions and psychology in your quality of life.
Peter, this is so important. I wanted to stop and reiterate that. Two questions. Are you happy? How are things in your life right now? Marriage, family, finances, job, so on. About 15 years or so ago, so I struggled with depression, my whole family, mom and dad, for years. And first of all, for a long time, I didn't know I was depressed. Then when I learned about it, I couldn't find a way through that. So I went to 7 psychologists over the years. And the last resort, went to a psychiatrist, very credentialed, wonderful individual. And I said, I'm willing to try any medication. Halfway through the session, a 15-minute session, he scribbled something, piece of paper, gave it to me. He says, Mr. Mehron, you're severely depressed. Go take this medication. I looked at it. It was for Prozac. Come back in 3 weeks. We will continue our therapy. I felt so isolated and heard that, don't you want to know who I am? That had he asked me, are you happy? How are things in your life? I would have just felt that somebody actually interested in me. And it would have been opening my heart, my soul, that somebody I can talk to, because I was desperate to talk to somebody. So the power of those basic human questions, these are not clinical questions. These are almost like a spiritual question that, how are things for you in life? Those they change somebody's lives, those questions.
Yes. Yes. It's very powerful. And I think it's really important. You and I have been doing this for a long period of time, right? So we feel very comfortable with it. But I try not to take for granted what it takes for an individual to come and sit here in this room, this couch or this chair, and talk to me. Never take for granted what they're thinking. What does this mean? If I'm seeing a psychiatrist, am I crazy? Then have I let my family down? Have I let myself down because they've come to see Peter? That's who I am.
Yeah.
And yes, it's Dr. Zafirides, but it's Peter. And I think keeping that in mind at the beginning, particularly that initial session, is doing everything that we can to humanize that moment because we
Yes,
don't have any idea. We feel totally comfortable because we love what we do and we've done this. And to us, it feels like every day. And maybe it's easy for us to come up with a treatment plan. But I just trying not to take for granted what it took an individual to come in and see. And I think
that's
in
true.
that, it's really important to be as human as possible in that session and in those questions that you ask. You can get
Yeah,
diagnostic information pretty quickly. AI can do that pretty quickly.
that's right.
Right?
That's right.
We know symptoms, that's fine. But
Yeah,
we don't know the human being and everything that it took for them to get to this point. And
yeah,
that's
yeah.
where I think it takes that time, and it can only happen with the proper human connection. Otherwise, all the medication in the world is not going to work, and you're not going to see that individual come back, or they're not going to take the medication. So I
That's
think that
right.
that is really, really important.
That's right. Peter, what you mentioned is that what I've noticed that people who come to see me, the way you describe your clients, they come in and they share in the first session a lot of heavy private emotions that they haven't talked to anybody about. They didn't even journal about, and they just want somebody they want to share, and they want somebody to hear those they're sharing without diagnosing, without clinicalizing it. And that person also not falling apart, the judgments. Oh, really? Just honoring them that their stories and convey through their demeanor, you can work through this. There's a way through that. Bring in some hope, some logic, some possibility. You've been through a lot, and there's a way to come through that.
Yes.
Which brings me your Compassionate Doctor Award. That is, this is the first time I've seen that award. First, congratulations to you, sir,
Thank you.
because we know from studies about the drivers of successful therapy for clinician, quality of human connection with your clinician is one of the strongest predictor for success and effectiveness of a therapeutic partnership. Speak to that. What does it mean to be a good doctor like you, compassionate doctor?
Again, I appreciate that award. I'm not sure how I got it, but it's lovely, wonderful that I did. But I think it just brings up the point that, for me, one of the biggest things to learn in psychiatry after my residency, because with residency, unfortunately, when I went through residency, we still learned quite a bit of therapy here at Ohio State University. So we were blessed to have that. But it was highly focused towards medication, and understandably, so. You're learning all of this. This is part of your training. But the biggest thing for me over the years with regards to healing has just been the realization of how much I have to focus on the connection, how
Yeah,
important that is first and foremost, or else all is lost. So for
yeah,
me, it's been a over the span of my career, and I don't know that I've perfected it to this point, but by any means. But I think that's probably been the thing that I've had to learn the most on my own is the
yeah,
power of that connection and how much that will dictate healing in the long run and how much that matters. And fortunately, I'm sure that's happened with you. And certainly in my sessions where people will say something that I might have mentioned to them about their
yeah,
strength or their ability, and they remember that and will come back months or years or even decades later and say,
yeah,
that really mattered to me that you said that. And it's not that I'm anyone special, but it just showed the power of being able to connect
yeah,
and the difference that that can make in another human being's life. I don't have magic powers. It's
yeah,
just the fact that I connected with you, it mattered, and you changed. And that is what we try to get to because I think that's underemphasized today
yeah,
in all of medicine. And we are go, go, let's get our productivity, let's get the person in and out, let's treat them with the medication. And I think we've lost some of that art of healing.
of the healing connection. And in your research, you talk about the three topics: loneliness as an epidemic all around us. You talk about closure and you talk about suffering. Let's take each one of them and do a double click. What is loneliness about, and why there's such a sense of, there's so much literature, writings about loneliness? What's going on?
Yeah. I know we have an epidemic of loneliness and data that has showed that just the idea of loneliness that we carry will take years, decades off our lives. What are we talking about there? We can be in a room of people, of family members, of loved ones, and feel even worse that we are alone. And I think that the loneliness really comes in the loneliness of our struggle and the loneliness of suffering. And the fact that maybe we feel like we can't talk to anyone about it, or that we feel that there is no hope. We cannot get better. So everyone we see around us is doing so much better than I am. Everyone is dealing with it, yet I am just sitting here and I'm putting on a face, and it isolates you. You feel like you're alone, where if we realized it, so many of us go through this, and it's part of the human experience. And part of it is just figuring out, where do I get the help that I need?
Yeah, yeah. This, having come from a corporate environment, I was doing the coaching and therapy within the corporate setting. What I saw very often, if not all the time, there's a meeting, conference room. People enter the room. You turn around and you call the people's name, typically by the status, the head of the program, the executive. Hey, good to see you. You have eye contact with them. Then there are other people walk in the room. They're almost invisible. Nobody sees them. Nobody turns to look at them. Hardly anybody asks their opinion. For a while, that was me. That registers that I'm invisible in a room among the colleagues. Part of the loneliness is about what you mentioned: being seen, being acknowledged, being invited. We don't do that. But it's just like, partly I need to do something to come out of isolation, loneliness. Then loneliness is really a contact sport. We need to help each other to bring that, to change that equation.
Yes, we really do. And we also need someone to guide us, right? Because,
Yeah.
like I said, some of that loneliness can be coming from suffering, and that suffering can be coming from feelings that we think are fixed forever, and that we are all alone. And sometimes just being able to relate is enough to free a person and make them
That's
feel
right.
better. That's the power that they have, not that I have, that they have, to be able to transform and change.
That's right. That's right. About closure, and you mentioned has the closure has two. No, yeah, I'm mixing up my question. Share about closure, then we go to suffering. What is closure?
Closure. When we talk about closure, all of us as human beings will try to understand the world around us and how we move through it and deal with everything. We all experience pain. We all
Mhm.
experience loss. Some of us have experienced much more trauma than others, but
Yeah.
suffering is part of the human experience. There's just no way around it. And I think, in terms of that, when we look at suffering, there is the suffering, the actual pain. And I
Mhm.
always try and tell people, using my own example of struggling with not only depression, but physical back pain. And there is that pain, and it hurts. And that is uncomfortable. I don't like
Yeah.
the way that it feels. It hurts. So that's
Yeah.
the pain and the suffering on one level. But the next level of suffering is the interpretation of what that means.
Mm.
So if I have back pain and I feel it's never going away,
Yeah.
now I've added another level of suffering. If it is going to impact my life where it's never going to go away and I won't be able to do the things that I want with my loved ones, with my family, or it will get worse, that I will be bedbound. This
Yeah.
is a second level of suffering that I am creating. And it preys on our insecurities and our vulnerabilities and
Yeah.
isn't necessarily true, if true at all. So
Yeah.
when we come to some sense of closure, it is I can suffer with pain, whether it is physical or emotional, but also I have to come to acceptance that this is there. And what it doesn't mean is some of these thoughts that make it even worse in the suffering. And when I'm talking about closure or acceptance, it is not in terms of giving up, right? Because even though we have
Mm,
pain, whether it's physical or emotional, that can get better too. But in the way that I add to it, that I'm causing even more pain for myself, I must realize A, that is happening. Two,
yeah.
I must do things to minimize that. And in that way, I gain a sense of acceptance in terms of my overall condition. So this can apply to physical symptoms, this can apply to depression, anxiety, isolation, numbness.
That's right. What I really appreciate what you mentioned, that pain and suffering is not a part of us be trying to almost compartmentalize. In fact, personally, I hate the term when people say such and such person is fighting against cancer. Cancer is part of our body. There's no such thing as fight. Is working through that, bringing healing. And there's Buddha who said pain is inevitable, suffering is discretionary. Is, to your point, is how do you think about it? How do you interpret that? How do you work with it? Because life will give us the sucker punch. All of us, we get it. How do we work with it? It makes all the difference.
That's
And,
absolutely true.
and in fact, that's the part I want to go back to, the sense of normal, that for individuals who struggle but say this is normal, it seems there's an element they take life's adversities or their own past struggles. That's life. That's how I am. I'm going to ignore it and plow through that. In your therapy, how do you help individuals to modify that?
Yes. First, I think we recognize, first and foremost, the strength of the individual. Oftentimes,
Mm,
those individuals that I see don't just have depression for the sake of having depression, purely just biological, came out of nowhere. These are amazing individuals who have been through loss, that have been through trauma, that have dealt with an incredible amount of stress, yet perform every day for those that count on them or need them, or
mhm.
for their own well being. And I think that it's really important to let them know you coming in and struggling to the degree that you have, but you're here,
Yeah,
represents the amount of strength that is truly within you. What we are going to try and investigate is how can we make this better? How do we use that strength? Take a look at why you're suffering in the way that you are. And are there ways that we can redefine this or understand it in a different way, or come at it where you can use those strengths to minimize the amount of
yeah.
suffering? Same strength that brought you here to help you get better. So I think that's first and foremost. And
That
then,
brings hope. That brings hope that you can do it. You have the strength. That's right.
but it's absolutely true. I'm not, there's no
Yeah,
patronizing. I'm looking right at the evidence. You have dealt with everything you just told me, and you are still alive and here.
yeah, yeah,
Even with how much pain you still have, you're here.
yeah,
How do we
yeah,
use that to try and make this better?
yeah. That's good. Question to you, staying with the individual who may have an element of they are pushing through. Every now and then, I am contacted by somebody who they call on behalf of their spouse or their teenager. Said that read your book, saw your podcast. My spouse can benefit from talking with you, or I know my spouse or partner is depressed, anxious, is grumpy, or she's grumpy at home, or my the teenager, like a young man or woman, is already in the college and schools are failing, doesn't want to go to class. they're anxious and depressed. They need help. And I talked with them. They said, I don't want to see anybody. They don't want to go see a professional. So they asked me, how do I approach that? So let me ask you, how I'm sure you get calls like that. How would you guide those conversations?
Yeah. The most important thing is honoring the resistance, honoring what it's taking for the individual to even make that decision, right?
Yeah.
And I
Yeah.
think supportive of that, allowing that to be human. I get it. I know that this is hard for you. I know that it is hard for you to want to go and see
Yeah.
Peter or artist, but I am really worried for you, and I'm worried for the would you do this? Go one time, right? And I
That's
try to
right.
tell
That's
people,
right.
especially if there's resistance when they come in. My name's Peter. I have 3 children. I've been married. I'm also a psychiatrist. But first and foremost, we need to push away this idea of what it means to come in and see a psychiatrist. We will have a
Yeah.
discussion. I will offer what I feel I can do to help you. And the only obligation you have is to this visit right now. And then you can tell me what you want to do after that. Because
That's
a
right.
lot of times there's this projection, oh, I'm going to go see a psychiatrist. I'm going to be on medication forever. It's never going to go away. I'm a crazy person.
Yeah.
So
Yeah.
really just trying to lower what it means for that moment, but also respecting what it takes. Again, it goes
Yeah.
back to that. Since we're used to it, but and I still to this day will take it for granted what it means for someone to come in and sit across the couch from me and actually feel okay with talking to a psychiatrist.
Exactly. Exactly. No, this is good. You talked about the suffering having two layers. Really caught my attention. Could you describe what are the two layers of suffering?
Yeah, and I think here being able to use maybe a little bit of that example of my physical pain or physical pain in general as people come in. And then that hurts, right? Whether it's depression, anxiety, physical pain, that is causing physical pain. But
Yeah.
then it is the assessment of the meaning that
Yeah.
then causes this next level of suffering, right? I'm
Yes.
hurting,
Yes.
but this is going to be forever. I'm hurting. This is never going to go away no matter what I do. I'm hurting. I'm not going to be able to play with my kids. I'm not going to be able to advance in my career. I'm not going to be able to retire
Right.
and have a good life because it hurts too much, right? So there's
Yeah.
the actual pain. And then there is I would argue, a greater level of pain that comes from the interpretation of what it means. And I see those as
Yeah.
2 layers of suffering. So here the approach is let's look at how you're interpreting that first, respecting the pain that is there, where it's coming from, depression, anxiety, or physical pain. But what are we doing? And I say that as someone who struggles with this almost on
Yeah.
a daily
Yeah.
basis.
Yes.
What am I doing to make this worse by my interpretation? And I have an obligation to myself to challenge that because it is not serving me. Coming to terms with that, an acceptance, if you will, that
Yeah.
I may have this struggle, but I also have a responsibility to what I do with this struggle.
Yeah.
That's where we can come to things like acceptance and closure.
Wonderful. Wonderful. So as we get into end of our time, Peter,
Yes.
what is one or two thoughts you want to share with our audience in the context of finding hope and then how to go beyond just being normal to actually to live a fuller lives? What would you like to offer them?
Well, I want people to realize that there is suffering and it exists everywhere. And if you're
Mhm.
hurting, you're by no means alone in your struggle. Please realize how many people are struggling, even those around you that you feel are adjusted and doing well.
Yeah.
Please don't feel that isolated. But also, help is available. And that is not patronizing, it is true.
Yeah.
You can feel better from where you are. And no matter what you've been through, and I know that people have been through much more difficult things than I've ever gone through, traumas of
Mhm.
all types,
Mhm.
is legion. And we have a responsibility as treaters to engage you as a human being and help guide you through that. But
Yeah.
you can get better and you continue to search for those who can help you if you have been to someone and don't feel comfortable with them, it is our responsibility to engage you and make you feel that you can get better, that it is our privilege and our obligation to help you. And if you don't feel that, go to someone who does, but you absolutely can feel better.
Wonderful. Thank you. Peter, question to you. In terms of your practice, do you see clients also virtually like Zoom or other, or is it all in person?
No, we still, with COVID, it changed everything. And still to this day, it's still a significant amount of individuals that I will see through teletherapy or telepsychiatry. So it probably makes up on any given day, maybe about a third of those that I see. So it's just become convenient for many people.
Exactly. Good news for our listeners. So, as part of our the podcast, Peter's information, contact information to his clinic, to his writings will be available. So, Peter is there, a compassionate doctor. On a personal note, I wish 15 years ago when I went to see a psychiatrist, there was somebody like you at that time. My trajectory of health would have been very different. Where knowing you exist, people like you exist, is just so reassuring for to help people bring them faster and more hopeful in their journey. Peter, thank you. Thank you so much for your time, for your dedication and having a rich conversation. And to our listeners, the topic today is that life, pain, struggles, trauma, depression, these are facts of life. We all experience them at one way or another, whether in early in life, all the way. Some of my clients are grandparents in their 80s. We experience them. Two things Peter mentioned. One is that healing is not about being bravado and I'm going to crush it myself. Healing is about contact. It takes a village, literally does. We need to create connections, support, whether it's your therapist, loved ones, friends, creating coming from isolation to connection. Number one. Number two, instead of trying to plowing through, finding help to bring some wisdom, some hope, and some tools and skills for you to go to the next level. One thing we know, there are problems. In fact, I learned this from my psychology mentors years ago. It says sometimes sitting on pain, it doesn't get better. You need to find a way to address it, to resolve it. We cannot wish our struggles to go away. We need to do something about it. So if you're struggling, reach out to people in your orbit about finding help to bring you more hope, more joy, and better living. Thank you so much. Person, I'm looking forward to do another podcast with Peter soon to go to another aspects of health and healing. Thank you. Be well.
Thank you, Ardashir. It's been a privilege to be part of this, and I would very much look forward to a further conversation. I'll say two things and then I will stop talking. But one, to those that are listening, your strength is absolutely legion, and don't let anyone lead you in any other way than that. You are so strong. Never doubt that. And remember that the privilege is always ours in taking care of you, not the other way around. And if you don't feel that from someone that is treating you, find another person, because it is our privilege to treat you.
Thank you so much.